As we continue in Module 5, we're going to talk about some of the different aspects within athletic training, such as abbreviations, some routine care, and some questions on if medical documentation should occur or not occur in some situations. So to begin, we're going to first talk about abbreviations. And as you can see in this little meme, there may be a large amount of abbreviations that you don't know. On the reverse side, there may be people who know every single abbreviation on here. And that's just something that we need to consider. So let's think about this. If I am working with you in a clinic and I do not know the abbreviations that you put in the medical documentation, it is not going to be an effective way for patient care. It is going to either require me to look all these up, or as the athletic trainer, I may just choose to not look it up and not utilize that communication and that information I have from the other healthcare provider. And so thinking about abbreviations within your athletic training facility and within your staff, what the best practice guidelines recommends is that athletic trainers work to create a list of abbreviations. This list of abbreviations should be all of the ones that your clinic chooses to do. Once you have an abbreviation list, it's easy to then go and memorize those abbreviations specifically and utilize those within your documentation. It's vital that if you choose a word to be abbreviated, that you always use that word in an abbreviation in your medical documentation. This is also a good way to start introducing this to some of the athletic training students that you monitor and allow them to start learning specific abbreviations that you have deemed to be important and necessary within medical documentation. The next part I want to talk today about is routine care. So this is a question I get all the time of, hey Beth, should this be documented or not? And a lot of these aspects include things like stretching, or if you have taping, if you have somebody using a foam roller, or if you're taking care of wounds. And going through these different things, talking about stretching and foam rolling together. So these two aspects, if a patient is just coming in and is talking about trying to just utilize the materials and the equipment within your facility, that's something that you don't have to document daily, but could do like a weekly check-in. A lot of EMRs allow spaces for notes, and this is a part that you could put that information there to allow patients to still get the documentation that they need and state that you have seen them and talked to them, but it does not need to require the day-to-day and in-depth documentation. That's the same for prophylactic taping, but keep in mind this is different if your patient has suffered, say, an ankle sprain and you are taping their ankle. This is a different aspect than just taping somebody before a game because they have asked you to. Wound care is another one that people talk to me a lot about, and this is something that anytime that you perform generalized wound care, you need to be documenting this. So if you go through and clean cuts out, or if you go through and are debriding an area, that all needs to be written down. There's a fact and chance for infection, and it needs to be documented within the patient's care. Now, it's understandable to not go through and create this long, drawn-out soap note, but to give examples of what you used, how you cleaned it, that should be within the patient's medical documentation. Another common question I get is when athletic trainers define an injury based on how they think it should or shouldn't be documented. So you are, let's say, working in a secondary school setting, and somebody comes in and you perform an evaluation, but you do not find anything wrong. Some people at that point deem that medical documentation does not need to occur. But I challenge you this. Think about the fact that if that patient had gone to see a physician, would that physician document that service? The answer is absolutely. So why should we be anything different within athletic training? It's important to keep our standards as high as other healthcare professionals, not only for ourselves, not only to show our worth, but ultimately for patient care. So keep that in mind anytime you're going through and wondering what you should or shouldn't document for a patient. And the last thing I want to talk to you today about is when should medical documentation happen. And ideally, we would like this to happen during or immediately after. Some people say that, if you're documenting during patient care, that it's not giving patient-centered care and it's not showing the patient that you're engaged. If you've gone to a physician or a physical therapist or any other healthcare provider, this is something that oftentimes happens. So why do we treat it differently within athletic training and think that it's unprofessional to have our computer there and type up some notes as we're working with our patients? If you can't do it or during, it's important to maybe do it immediately after. So spending some time after you've scheduled your patients to document. If that is not possible for you at your current time, this should be completed within 24 hours. Go back to the scenario of when you documented last. Do we even remember exactly what people did? So will speak for myself, but if I do a shoulder evaluation and I'm measuring internal rotation, external rotation, flexion, extension, I'm going to have a very hard time guaranteeing that I remember all of the numbers of range of motion, let alone the numbers of muscle testing or any other objective measures that I got. So a tip, if you can't do this or aren't able to be by your computer or your documentation system, try dictation. There's a lot of different ways to keep legal ways and BAA standards to document patient care. Something such as like leaving a note on a locked cell phone. This information is then secured. You're able to have that information on your phone quickly in a password protected manner and go back when you have that documentation system available.